Hello everyone. Today the topic is isoenzymes. Multiple forms of the same enzyme are called as isoenzymes or isozymes. They have different structure but identical function. Both the isoenzymes have different structure but identical function. The isoenzymes are tissue specific and help in regulation of enzyme activity. They help in understanding disease of different organs. Examples: isoenzymes of lactate dehydrogenase and creatine phosphokinase. So multiple forms of the same enzyme are called isoenzymes or isozymes. They have different structure but identical function. Isoenzymes are tissue specific and therefore help in regulation of enzyme activity. The isoenzymes help in understanding the disease of different organs. Examples of isoenzymes are isoenzymes of lactate dehydrogenase and creatine phosphokinase. These isoenzymes differ in their physical and chemical properties, which include structure. They differ in the electrophoretic and immunological properties, differ in Km and Vmax values. They differ in their pH, optimum pH, relative susceptibility to inhibitors. They differ in their relative susceptibility to inhibitors, and they also differ in the degree of denaturation. First, isoenzyme of lactate dehydrogenase. Lactate dehydrogenase has 5 distinct isoenzymes: LDH1, LDH2, LDH3, LDH4 and LDH5. Lactate dehydrogenase is an enzyme which catalyzes the conversion of pyruvate to lactate in anaerobic glycolysis and also from lactate to pyruvate. And this particular LDH has 5 isoenzymes: 1, 2, 3, 4 and 5. The structure of LDH isoenzyme is a tetrameric enzyme. It has 4 subunits. That is why it is called as tetrameric enzyme, and it is made up of 4 polypeptide subunits. 2 types of subunits, namely M are for muscle and H for heart, are produced by different genes. LDH1 has all 4 subunits which is present in heart and RBC. LDH2 has 3 heart and 1 M subunit present in heart and RBC. LDH3 has 2 heart and 2 muscle present in brain and kidney. LDH4 is having 1 heart and 3 muscle subunit present in liver and skeletal muscle. LDH5 has all muscle, that is M4, and it is present in skeletal muscle and liver. Coming to the diagnostic importance of lactate dehydrogenase, it has immense value in the diagnosis of heart and liver related disorders. The normal value is 100 to 200 international units per liter. In normal individuals, LDH2 is more than LDH1 in serum, whereas in MI, that is in myocardial infarction, LDH1 is very much higher than LDH2, and that rises within 12 to 24 hours after infarction, and this particular pattern is called as flipped pattern. LDH1 increasing more than LDH2 is called as flipped pattern, and that is seen in myocardial infarction within 12 to 24 hours. Increased LDH5 is an indicator of liver disease. LDH activity in RBC is 80 to 100 times more than that in serum. Hence, sample should be free from hemolysis to avoid false positive results. So carefully it should be seen that the serum is free from hemolysis, because the LDH activity in red blood cells is more than in serum. Next is isoenzymes of creatine phosphokinase. This is the enzyme which catalyzes the conversion of phosphocreatine to creatine. Now it is a dimeric enzyme with 2 subunits, that is muscle and brain. Now this has 3 isoenzymes. CPK has 3 isoenzymes. CPK1, the subunits are both brain subunits, and the tissue of origin is brain. CPK2, it has 1 muscle and 1 brain, and the tissue of origin is heart. Whereas CPK3, it has 2 muscle subunits and the tissue of origin is skeletal muscle. Normally, the CPK is not detectable in serum, whereas in MI, CPK2 increases within 6 to 18 hours. CPK2 is not raised in skeletal muscle disorders, hence is the earliest reliable indicator for myocardial infarction. If you see the graph, CPK is the enzyme that is raising very immediately, that is within 6 to 18 hours, and so it is the earliest reliable indication for MI. Next, isoenzymes of alkaline phosphatase ALP. This is a monomeric enzyme that it has only one subunit. Normal value is 40 to 125 units per liter. Isoenzymes are alpha 1 ALP, alpha 2 heat labile ALP, alpha 2 heat stable ALP, pre-beta ALP and gamma ALP. Increased alpha 2 heat labile ALP is seen in hepatitis. Increased pre-beta ALP is seen in bone disease. So the multiple forms of the same enzyme are called as isoenzymes. They have different structure but same function. These isoenzymes are tissue specific and thus help in regulation of the enzyme activity. Coming to the examples, lactate dehydrogenase, it has 5 isoenzymes. CPK, it has, that is creatine phosphokinase, it has 3 isoenzymes, and alkaline phosphatase, it has 5 isoenzymes. Thank you.